So, welcome, dear participants, in this new webinar on smile design. It's called From Pixels to Possibilities, and together we will look at the evolution and future of smile design. My name is Roland de Pape. I'm a product manager for Modern Dental Europe, and I will share my screen with you to start the presentation now. If you have questions during the webinar, in the upper right corner, you can see a chat box, and there you can type your questions. And then after the webinar, we will take the time to answer those questions. So let's get started. First of all, Modern Dental Europe, to give you an idea, is part of the Modern Dental Group of the global network. That means Modern Dental Europe is active in 10 different countries in Western Europe under different brand names. In 5 countries, we operate as Élysée Dental. In Germany, we have Permadental and DD Dental. In France, Labocast. In the UK, Southern Cross. In Sweden, we have CDI. So these are all different branches belonging to the same Modern Dental Europe group. And globally, we belong to the Modern Dental group. That means we all work with our production facilities. And here you see one of our production facilities in Dongguan in China, where we really have a state-of-the-art, future-oriented setup. A lot of CAD/CAM, new technology, new devices, new software, which is applied there. And what is really nice is that they also have their own school, their own education center, where we always try to keep up with new technologies. So our technicians are more and more today designers, and that's also something we will talk about today when we discuss smile design. Of course, we need those designers to be able to do what we used to do in the past in the analog way on a plaster model, working with wax. Today, everything happens in terms of smile design in software packages, and here we use the ExoCAD Smile Creator package, where we design and we can have a virtual simulation of the treatment plan. And in our solution pool, we have actually 2 different options we are offering for smile design. The first one is what we call diagnostic design, and there we have a fixed flat rate price of 99 euros, and this is for a full mouth case. In this diagnostic design, we just show the intraoral scans and a quick diagnostic ExoCAD design viewer, where you can also, as a practitioner, watch the viewer to consent or also discuss with your patient the treatment plan. And then if something needs to be changed, you can communicate with us, and then we can adapt the plan according to the needs. So this is simple, straightforward smile design based on scans. And then the second option, which is more elaborated, is what we call the integrative smile design. And this is from this year on a fixed price of 149 euros. So that means for both options, we have a more attractive price this year for smile design, because we realize this is really an important part of the workflow, and you really need to use this smile design today to convince the patient and to discuss the treatment plan. So this integrative smile design, here we really see we use all the technology, and we see the real revolution in smile design in the software, which is really transforming the way we look at treatment plans and dentistry today, actually. So we will look in this presentation at some principles we are using for the smile design, and we will explore all the possibilities, and I will explain what is possible in 2D, 3D, and 4D today using these smile designs. So here on this video, you see also how we use in our lab even this integrative smile design based on face scans for denture design, so for removable dentures, which is also actually a 100% digital product, the Evo Fusion denture. So the first step is, of course, important to point out that there are some major important benefits of using integrative smile design. Of course, it offers us a realistic preview of what could be the final result of the restorative treatment. And of course, you can use this. It's not just a design process. It's really an excellent communication tool to use towards your patient. It opens up the communication, and you can discuss all the concerns and expectations in this so-called wish interview with your patient. And we have seen really that the percentage of case acceptance is increasing really high to when we are using this kind of visual representations of the treatment plan. So the decision-making process is a lot easier, and you really have a useful tool there to sell also your treatment. So we always follow different steps. First of all, we have the wish interview with the patient. So you have there a detailed discussion, of course. You can discuss the concerns, what do they dislike about their current smile, what are their desires, what do they want to see improved on their smile. So really, what are they looking for? And of course, not to forget, what is the budget? So also the budget needs to be discussed to see if it is realistic in terms of the end goal. When this is all clear, then of course you can go to the second step, which is actually gathering all the files, all the data. And in this data acquisition step, you just perform the scanner procedure with your intraoral scanner. If you don't have an intraoral scanner yet, you can also take, of course, conventional impressions, send them to the lab, and we will digitize on our side these impressions. And of course, we will prepare the whole smile design, further protocol, 100% digital, so that you have also the virtual digital smile design to show the patient. So here you can take the scans. You can take also some photographs, face scans, if you have this opportunity, to for the lab, for us to create this integrative smile design. At that point, you order the smile design, and you can also, after approving the smile design, or after giving comments on the design, and we do some adjustments if needed, you can also order the mock-up, the try-in, which is still a valid and important step. I will explain later on why and how we use this mock-up step. And then finally, we come then to the final treatment plan. This is, of course, based upon the feedback after the smile design, after the mock-up stage. And then we can go to the execution phase, which is printing, milling, producing the final restorations. So this can be veneers, crowns, Onyx bridges, or also aligners, or combi treatments of aligners and restorative solutions. So the whole process is also towards the patient, of course, important to manage these expectations really good and to also communicate both with the patient but also with the lab to see if we need to adjust something in the plans, taking into account maybe the material limitations, for instance, lithium disilicate versus zirconia, maybe restrictions on the preparation or on the bite. So things like this might slightly change the plans, but finally we all work together towards the final outcome, which should be a final prosthetics, ensuring and offering functionality and also, of course, longevity of the final work. Okay, so the first step is always looking at the initial state, and there we take the scans, upper and lower, and the bite scan. And what we always need also is two photos, two pictures. Two main photos are always required. One is the patient in maximum smiling, and one is the patient with retractors. So these two are mandatory. Additional pictures or videos, for instance, can further refine the treatment plan, but we for sure need these two. You could also take profile shots or 12 o'clock photos to see where the incisal line touches the lower lip, for instance. But we need to work or to be able to make the proper smile design. These are the two main pictures, and of course the scans. And then it starts by looking at the face. That's why we need the pictures, because we are talking about a facial driven smile design. This integrative smile design is facial driven. That means we look at the aesthetic helplines, the landmarks on the face, the shape of the face, and of course we go much further. We also look at the individual teeth, the elements, or the rest dentition in this case. We look at the gingival line, the width and the height of every individual element, and also very important, the axis of the different teeth. So after measuring all this, we use this data then for the smile design. If there are no teeth left, if it's an edentulous case, of course, we have to follow the rules for removable dentures using a wax rim. And then, of course, we determine where the central incisor should start, upper lip at maximum smile, and where it should end approximately 2 millimeters below the upper lip at rest position. Okay, so what is important for the actual smile design is that we take into account, and that's what we do in the software, in the Exocad Smile Creator software. We look at the teeth, at the rest dentition, at the face, and then it starts by analyzing all those aesthetic data and guidelines. We have to know, first of all, if it's a man or a woman, so the gender, the midline. Sometimes we have a midline shift. Important to know is that if this midline shift is less than 2 millimeters, it's not really considered a disturbing factor in the smile design. But of course, the axis of the midline, that's should be 100% straight. That's a really important factor. Then we look at the axis inclination of all the teeth in the aesthetic zone, the width and the height, the gingival zenith, of course, should be at the proper height and position, also slightly too distal. And then we have the interdental papilla, the incisal embrasures. So that's really about the tooth shape, then contact zones, and of course also the buccal corridor. So the smile width and the labial corridor should also be balanced in the aesthetic zone to come to a complete, nice picture. So what are we using here as general guidelines? We are actually using the so-called golden proportion or golden ratio. And this golden ratio, the simplest description of the golden proportion is that if we take the lateral incisal as a factor 1, then the central incisor should be or would be 1.6, and the visible part of the canine, which is the mesial part in this frontal picture of the canine usually, would be 0.6. So that's what is considered as golden proportion for front teeth. And then, of course, it's all about measurements and rules and symmetry and proportions. For the if you have this abrasion, worn dentition, we still have a good view on the width of the teeth, and then normally the width is between 75 and 80% of the height, of the length. So like this, we can calculate the ideal length of the central incisor, which is in this case then 10.4. And then for the ideal vertical dimension, the length from gingival line of the upper incisors to gingival line of the lower incisors, we look at multiplying by the golden ratio 1.6, which leads here to a total vertical ideal vertical length of 16.8 millimeters. So this is with, of course, also the overbite of 2 millimeters included. So this is quite normal. Normally we have about 18 millimeters. So these are proportions, measurements, and let's say calculations we can do to come to what we call the ideal smile design. And of course, also on the tooth shape, we are using actually aesthetic libraries here. A very known aesthetic library is from the book, famous book from Dr. Jan Haito, Anteriors. There he has actually very nice natural tooth shapes for both female and male. And these are digitized now. So this is an exclusive database which we can use in the software to design nice smile designs. And what you can see here is an example of this library where you can see we also have the possibility actually to shrink down the teeth from the enamel silhouette down to the dentin core, where you actually see the dentin core and the mamelon structure of the dentin. And this is a feature we are actually using in our FIT for veneer solution, because there we are injecting in 2 steps. First, the dentin layer with the dentin injectable composite in a translucent key, and then we move on with an enamel composite in a translucent key. So that's why we print both models of both structures and use this library and this shrinkage mode to get there. So once all this work is done and the smile design is approved, then an important step is optional, but for full arch rehabilitations, it's advisable to still order a mock-up. So this mock-up, we are using a mock-up like this. We print a model, we create a putty key, and there you can just use any resin or provisional resin material to, in one block, create a mock-up. And this already gives you a chance to physically test the jaw movement, if there are no premature contacts. You can check the aesthetic planes, discuss already everything with the patient, but also very important, you can check the actual physical lip support. And this is of course not possible in the virtual environment in the smile design, because there is no impact or influence of the muscles. This can be also age related, a little bit different, and also of course the phonetics can only be tested at this point using this kind of physical try-in or mock-up phase. So very important, phonetic analysis and lip support, which we cannot perform virtually. So as a practitioners, I advise you to order a mock-up putty key to do this additional evaluation of this full rehabilitation cases. If during the mock-up something should be changed, you can rescan, of course, you can adapt the mock-up, you can grind it, or you can apply extra resin or composite on top, and then we need a rescan in the lab, and then this rescan is actually the base to the reference to for the final work. An important question is, what about the increase of vertical dimension of occlusion, and also how can you register this new vertical dimension? And an interesting and easy straightforward technique is the leaf gauge technique. So here you can buy those leaf gauges from any dental depot, and every leaf has a thickness of 0.1 millimeter. So you build them up towards the desired increase, let's say 1.5 millimeter, and then you can position this between the front teeth, and then you can stabilize the bite using some kind of futar in this case, or exabite bite registration stable silicone material, and then you can start scanning left and right with your scanner to register this new occlusion, this new height. So this is really important, like for fit wear cases, for instance, or for most complete rehabilitations. If you there you always start, of course, in central relation, because that's the only reference we have if everything is rebuilt, to use this leaf gauge technique for the height. One important advice, don't just mention to the lab to increase the bite with, for instance, 2 millimeter, because we need to know exactly where we should increase. Because you know, on the if it's on the incisal pin, it's quite different than in the posterior area or in the anterior zone. So there is actually a general rule that increasing the vertical dimension of occlusion in centric relation with the hinge axis movement of 1 millimeter in the molar, in the posterior area, not only increases the space in the anterior zone by around 2 millimeters, it also increases the overjet by 1.3 millimeters. So due to this simple clockwise rotation of the mandible, you also have this influence on the overbite, not to forget. So as a general rule for planning, the vertical dimension of occlusion based on the length of the upper and the lower incisors and the overbite, general rule is 18 millimeters. That's the 18 millimeter rule, which says 11 millimeters for the upper and 9 for the lower incisors and 2 millimeters overbite. So this actually serves as a good basic, as a good reference for the initial planning of the vertical dimension of occlusion. However, if the position, of course, of the gingival zenith has to be changed, this, of course, needs to be taken into account also in the total length. So these are some important rules we need to take into account before we can go to the final prepping, the preparation. And here again, you can also work guided if you want, especially for these big span bridges or full mouth rehabilitations. It's always helpful to order guides, and we have different guides available, starting from for gingivectomy, gingival reduction guides. We have prep guides, different kinds. We have post-prep check guides, and of course we also have the index, the putty silicon key for final simulation of the temp. And then you can also use this depth gauge burrs for minimal invasive prepping through the actual temps. So that's all possible in terms of preparation and guides, all in line with the minimal invasive dentistry philosophy. Because at the end, you know, as well as I do, it's all about also taking the patients into this workflow, into this process, and it's also a concept of emotional dentistry to come to a final result, which is actually not only accepted, but also in line with what was presented in the smile design stage. So this is very important to come to this end result. And how do we do this? We also offer always this full report showing pre-treatment pictures, post-treatment pictures. This is then rendered and generated by the smile design software. Excuse me. And then you also have the measurements, the helplines there, and of course from different angles, different views, the original scan data from the initial state, and then the proposal, the plan, the restorative proposal also from different views. So this is all to help you to present the treatment plan and to come to an agreement on the treatment plan. Sharing a lot of files, it's not always easy, and there are some interesting platforms today which offer also solutions in terms of easy sharing, cloud-based storage, and also in real time chatting in a chat box on smile design and on treatment planning. So one interesting platform is Smile Cloud. If you are interested, we have an account also on Smile Cloud as a lab. So if you create a doctor's account, this is a platform where you can share your scans, you can share your pictures, even your CBCTs or whatever. And there's a chat box to talk about the case. You can also invite colleagues or a professor or peers to discuss the case. And in the software, there's also a smile design using natural tooth shapes, and this library is working also through AI to offer the best fitting tooth shape, a proposal for this particular patient, and then you can still morph and adapt as you wish in the software. So all 2D now in SmileCloud, but there will be an upgrade very soon towards 3D also, using face scans. And talking about face scans or 3D, we as a lab, we are not only resellers for intraoral scanners like 3Shape, Medit, or Electra. It's very important that we do this, because then we have the knowledge of these devices, but also the technology and the software, and we can assist you on using those. And that's why we also became reseller for the RayFace face scanner. And this is this beautiful device, which has different cameras in those arms, capturing actually the face very easy in less than 1 second. It's a single shot capture, and then you have your 3D face scan available in the software. Nice to know is that there is one camera in the middle which captures the oral environment very, very detailed. So you see here on the picture, the mesh actually is very accurate. And we need this in the software for the alignment step between the actual face scan and then our intraoral scanners. So you can go directly to 3Shape or Medit Cloud, find your patient scans, and then in the software, it's actually really a matter of seconds to align those two together, to merge those files in one image, in one 3D image. And here you can see in this cross section how accurate the actual match is between your intraoral scans and the face scan. So this is all done automatically, AI generated by the RayFace software. And what is really nice now, it also offers us automatically all the reference planes, and very important, the virtual face bow. So by aligning the intraoral scans, the arches in the face of the patient, in the skull of the patient, we have actually a virtual face bow. And this is, of course, really important for our treatment plan. So you see it here, the reference planes, and also the 3D orientation of the intraoral scans in the face scan. Why is this important? Inconsistency of this orientation, inconsistency of the bite information in general, based on just 2D images, can really create a lot of problems, and we all know them. A shift of the horizontal line because there was inconsistency in bite information. So this can all be avoided if you go 3D using face scanners and aligning your intraoral scanners. And even as an extra feature in the Ray software, you also can use Ray Fusion. So you can also integrate DICOM, CBCT, and then align these scans also with your intraoral scan and the face scan. So this is a little bit more, let's say, for high-end, maybe surgery, maxillofacial surgery, orthodontic osteotomies, for instance, where they can really prepare everything in this virtual environment, but also, of course, interesting to communicate on interdisciplinary treatment plans, for instance, between the surgeon and the orthodontist, or for instance, to prepare implant surgery. You can also segmentate all the different structures and every individual tooth. So you can also virtually extract a tooth and place an implant here in this virtual environment. So this is a very nice tool, but maybe a little bit over the top for, let's say, the general practitioners. But still, for general practitioners, this 3D face scan, this avatar, gives you a lot of added value, because we have the patient here in the natural head position. That's the first thing. We have the digital face bow, as I explained, so the correct 3D orientation of the occlusal plane in the face. And this is, of course, very, very important for different treatments, because then we have the correct start point for any prosthetic treatment, but also for orthodontics, for aligned treatments. If the inclination, the axis of the front teeth, for instance, is not perfectly aligned, which is virtually impossible on a 2D image, you don't have the correct start point, and actually you cannot really evaluate a treatment plan. So this is really an added value to have this correct 3D orientation and this digital face bow. On top you have all the reference planes, and of course your designs can start now facial driven. So this means for the first time we have the patient always on board. The patient is there. We can plan on the face in this 3D environment. This was actually always the problem in the lab. Sometimes we didn't even know if the patient was male or female, so there was no indication on the gender, age, etc. Now we see the patient in the lab, and we can also perform a real nice face-driven smile design. So this will, of course, the smile design will fit the patient better, more individual, and this will also help the concentrate that the patient actually in the end agrees with the treatment plan. So correct treatment plans, more predictable treatment plans for different indications, prosthodontic, implant work, ortho, or combinations. So why is this so important, these face-driven restorations? Well, actually, it always starts from the face. We are not creating nice teeth only, we are creating a new smile for this full rehabilitation cases, for instance, an all-on-X case, or a denture also, just a removable denture. This should be started always create a smile from the face. We have to look at the shape of the entire face, at the midline, the reference planes, and then decide on this to determine the proper size, shape of the actual teeth in the design. So it makes it maybe a little bit more complex, but using these new software tools, it's all quite straightforward, easy procedure. We use the golden ratio, and then this leads really to better treatment plans, better smile designs, and an increased concentrate. Always follow the logical steps. It's not because we go digital now that we can forget this interdisciplinary strategy. First looking at the position of the jaws, then in a second phase look at the position of the teeth. So first move the jaws if necessary, then move the teeth, then look at are there some teeth missing, do we have to place implants. Looking at the next step is the relation and the vertical dimension. Then do we need to perform crown lengthening, gingivectomy, and then at the final stage is the restorative only and it's not because we think digital today that we can forget this workflow. Often we see cases where implants are already placed, and then the patient, and then the question comes: can we start an aligned treatment here? So it's the other way around. We really need to follow this strategy, and digital tools help us to show the patient, to convince the patient, also in this multidisciplinary, in this combi treatment cases. So we create always digital. That's the first step with our scanners, with our face scanners. Then we communicate also digital, because the Smile design offers us the possibility to do this. And this is a tool which helps there really to finally come from the CAD, the design, towards the manufacturing, to the CAM. So we can convert then after approval to CAM, which means execution, production, and finally milling or printing or whatever to produce the final solution. So talking about face scanners is of course really nice, but we also know that these are expensive devices, and that's why we are also following up what is happening on the market today. And for some time we've been looking at this Clone app, which is available in the App Store, which was already a nice tool, just a 3D scanner for daily objects. But this company actually invested in dental now and improved dramatically their in their software. This means now they came out with the new version, Clone Dental Pro. And in this Clone Dental Pro, it's available in the App Store. You need an iPhone 12 or higher, and then you can perform with your normal iPhone a really very good, decent face scan, and for a very good price. And we, as Modern Dental and all our branches, are offering also the possibility to purchase this through us at the price of 149 euros only per year. So this is an annual subscription where you can make as many face scans as you want for 1 year. It's very easy. It's only 20-30 seconds scanning around the face, and then you zoom in on the oral zone, and then you see that actually the mesh is also quite detailed here. It's very comparable actually to Rayface, which is amazing, and they did an amazing job here in quality if you see these results. Of course, the whole software as we have it, as we see it in this Rayface device, this is not available. We cannot automatically align with the intraoral scans or incorporate CBCT, etc. But we can do all this in our Smile Design software, in the exocad Smile Creator. So you can just send us the face scan, send us the intraoral scans, and we can merge them together in exocad to perform the Smile Design. So the assembly of what we have seen in the Rayface, the face scan, and the various planes, we do this in the lab in exocad. And of course, why do we need to do this? We've seen this here also in exocad. Then, if we play with the transparency of the image, you can see we also get this perfect virtual face bow, the 3D correct orientation of the arches in the face, and that's actually what we need, and similar to what we have been doing analog for many years with the classic face bow. Okay, so this is in exocad then, and there we use this data also the vertical dimension of occlusion to design prosthetics with much greater precision, with the perfect position on the mounting table. And this is, of course, still in a virtual articulator using average values, but still we have all the data available. For individual values, we will talk about 4D in 2 seconds. Just to inform you, to give you the full picture, if you are interested in purchasing this in the App Store, you just download it in the App Store, then you go to the menu, click on the 3 dots, and then you send feedback, and then you can it opens a mail window, and there you can just type Modern Dental Premium and your client number, or the lab like Elysee, Labocast, Permadental, DD Dental, Southern Cross, all the labs from our group are in this premium option, and then you can actually send the mail. You get a mail back which contains a link. If you click on the link, then you automatically upgrade to premium, and you can start using your phone as a face scan. Really easy. We invoice you 149 euros. If you would buy it in the App Store, of course, that's also possible, but then you pay 50 euros more. Nice app. It's very easy to use, and it gives an incredible detailed mesh and very high quality of face scan. And of course, we use it, but you can also use it, for instance, in MeditLink. There you can also just in a few steps align the face scan with your intraoral scanners and have this perfect 3D orientation or virtual face bow available. So really, really interesting, this new app, using, of course, AI and algorithms to filter out the movement of your phone and also the movement of the patient's face when performing the face scan. So very nice. And to make the story complete today, we have to go after 3D to 4D. And 4D, this is the dimension of time when we register the movement of the jaw, the individual movement of this patient, and this can be done also with different devices today. For instance, the Mojo is a very known device, and this Mojo is actually, it's an advanced digital tool which really captures the jaw movement using 4D technology. So it enables really precise tracking of the mandibular movements, and this makes, of course, the diagnostics better, the treatment plan individual, and more precise and better overall. So how does it work? It just uses, I will play the video again, optical tracking to really record the dynamic jaw movements. You see also from both condyli the envelope of movement, and there you can also compare left and right condylus to see if you have maybe disorders which should be addressed in the treatment or during the production or fabrication of, for instance, a denture anolonics work to prevent premature contacts and chipping, etc. So very interesting. This is the next level. The next step is all can be integrated also in the Exocad software, so we can also add this to the smile design. Mojo is one option. The Ray face will also offer dynamic occlusion very soon. So there you can also go left, right, protrusion, retrusion movement and register this. everything can be segmented in the software, and then you can also look from various angles, look at the movement and the envelope of movement of the condyle, and just use this in your smile design. So these are all new technologies which take it one step further than the average value articulator. This is really individual, patient-centered treatment and smile design. So actually the whole story, everything we have been discussing up to now is about smile design and also actually about visualization. It's about the power of visualization, because we are taking the patient into a visual process where they already see the treatment, see the end result, and try to convince them to consent to the plan, to the treatment plan, which can sometimes be difficult. But this kind of digital tools, mock-ups of the new smile, can really help us to get there. So actually smile design, and for sure this integrative smile design, where you see 3D, 4D integration, this is already today a part of the future of dentistry. It's really transforming dentistry, and it allows dentists to really create precise, individual smile simulations, leading to higher consent rate of treatment plans, and of course a satisfying end result, a satisfying treatment overall experience for our patients. That must always be the goal. To conclude this webinar, and this is a little bit heads up, because I will not discuss this or disclose this fully in this webinar, but this is a new evolution, and it's already available today on our aligner TrioClear platform, where you can order today a combined smile design for align and restore cases. So it's already available. It's a new feature on the TrioClear platform. So the so-called align and restore cases, and it's allowing you to really seamlessly order combined treatment plans. So this approach is really to integrate pre-restorative treatment or pre-restorative alignment in the first place, and followed by then a restorative treatment in the second phase. And what we are doing here is we are superimposing actually the three essential layers, the three essential steps of the treatment, to show really the smile transformation, going from the initial state, pre-TrioClear situation, towards the post-align, the post-TrioClear situation, and this is then shown on our TrioClear platform in the iDesign software. So this is the final result after the align treatment, and then in a third step you see the smile design after the restoration, so the final outcome of the restorative work. So this combination of these combi cases and planning to be able to do facial driven planning using face scan for combi cases, this is really new. It's a novelty, where as a lab, of course, we have experience, a lot of experience. We made thousands of smile designs. We have a lot of experience with aligners, of course, and now we can combine this expertise to come to a perfect combined treatment plan. The first thing we always do here is, of course, we plan the restorations, where we want to go, where we want to end, and then we plan the ortho in function of these restorations to arrive to get to the best function and the best aesthetics. And this is, of course, all in line again with minimal invasive dentistry. This is one of the major advantages actually of incorporating pre-restorative alignment is its role in promoting minimal invasive dentistry and saving as much tooth structure or substance as possible. So very exciting. This is a new button on the TrioClear platform, Smile Design, and then you are guided into this combi case. If you want to learn more about Smile Design in general, align and restore cases, but let's say everything about digital dentistry or the transformative power of digital dentistry, we are organizing a symposium the first weekend of May. It's Friday the 2nd and Saturday the 3rd of May in Ibiza. And it will be there at the conference center in Ibiza, where we will host more than 400 dentists from different countries. We are already filling up the room very nicely, up to more than 300 participants today, so still some seats available. And we would like to welcome you there. 2 days we will have lectures in the morning, explaining a lot of different digital tools and applications, going from align, combined treatments, also implants, scan strategies for single implants, all on X cases, digital shade taking, composite injection techniques. So all these things will be presented on stage by 13 keynote speakers. And also very nice and important to know is that in the afternoon we offer actual workshops, hands-on workshops on some indications, and there you can really practically test and try what you have learned during the morning sessions. Work on models, inject composite, scan with the scanners, use different new scan sets for all on X. And we also have breakout sessions where we have some professors showing how they scan. For instance, Professor Lorusso will be there to do a live edentulous patient scanning. So all this will be very exciting 2 days where we will offer a lot, learn a lot, and of course also some time for pleasure. There's a rooftop event Friday evening where everybody's invited. So this will be an unforgettable experience, both on digital dentistry and also on the ability just to talk to your colleagues, your lab partner, some peers, professors, and see how this digital dentistry is really transforming our business and our profession. So thank you for your attention during my webinar, and I will just close the presentation here and look at questions, if you would have some questions. Yes, we have some questions, so thank you very much. We have one question from Marco Modestini. How much does the face scan cost made by the lab? So actually, we have in the lab, we have in some labs, we also have what we call a digital imaging center. For instance, in our lab in Belgium, in the Netherlands, there we still also have a quite big local labs. And there you have the opportunity to come with your patient for the face scan. And this is this registration is 50 euros normally. But of course, now you have also the possibility to perform it, to buy the app for 149 euros, the clone app, which also provides you with a very good face scan. So that's also a good option. Both are possible, but just to be clear, in some countries we don't offer the imaging center, or we didn't install an imaging center yet. So there, the best option is just to go for the Clone Dental Pro app and perform your face scans like that. The leaf gauge, I don't know exactly what the question is. It's maybe also on the price. It's not really expensive. I think I bought some at Shine at some point, and it was around 25 euros or something. So that's the question. Can you also provide some brand of leaf we can use for the vertical dimension of occlusion? Well, I think the best thing you can do is just go to the website of Henry Schein or your dental dealer and just type in leaf gauge, and then you will see probably one or two brands which they sell. And then thank you for the questions. The photos are so for the basic smile design, yes, there. So that's what I try to explain in the beginning of the webinar. So we have actually two options. For some cases, there are no photos available, unfortunately, or no face scan available, or there is no only a scan or an impression taken. So then, of course, we do our best on those data to perform with the golden ratios to make a decent smile design. But of course, I think after this webinar, you understand that it's really necessary to have a good or to have pictures and a face scan available to do a facial driven smile design. Okay. So thank you very much for the questions. Hi, Tim. Nice that you joined. Thank you for your nice comments. So I wish you all a very good evening also. I think I had all the questions. If some questions would pop up later on, please don't hesitate to contact us. You can always call us or send a mail, and then we will send those questions and the elaborated answers to all the participants of the webinar. So hope to see you soon, maybe in Ibiza, maybe on an other webinar, or at a real hands-on course somewhere, exhibition. But stay tuned, and I hope to meet you all soon. Have a good evening. Bye.